Care to chat? Hello and welcome to our podcast from the Northern Ireland Social Care Council. Social care and social work are such enormously important parts of life here. They really came to the fore during the pandemic, and now with the crisis in the health service, they're in the news again. So in these podcasts, we're going to find out about these jobs, the people who work in them, the routes into social care and social work, how staff can progress and develop their careers, about the reforms taking place, and very importantly, how people in these fields take care of themselves as well as their clients. This time, how to foster equality, diversity and inclusion in social work and social care. Northern Ireland has changed a great deal in recent years. It's timely perhaps that we're talking about this as the Good Friday Agreement reaches its 25-year milestone. A quarter of a century on, we now have a workforce in which a migrant population is playing an ever greater role. So how's that working out? What's happening in social work and social care? With me are Anne-Marie Gray, who's Professor of Social Policy in the School of Criminology, Politics and Social Policy at Ulster University, and Paul Rooney, Professional Advisor at the Social Care Council. Thanks both of you very much for joining me for this podcast. Anne-Marie, maybe you could set the scene for us here and tell us what is gender equality, the legislative polity context that we're in here as well. Where does racism fit into this? I know this is an enormous question, but maybe we could start with those.
Well, maybe we'll start with gender, because I think care work generally is so associated with women, and that's a very historical thing and goes back to the origins of social work. But what that has meant is that these workforces, both social work and social care, have always been predominantly female. Now, that in itself, you might think, is not necessarily a problem, but it has come to be a problem because I guess it has meant that care work has become associated with work of less value, because women in these workforces were seen to replicate what they often did in the home. And I think as a society, we quite often don't value that care work for that reason, because we don't see it as formal, we don't see it as professional, and we don't see it as suited to men, because we still hold on to these old traditional ideas about work for men and work for women. And I think in a very diverse society where our clients are diverse, where users are diverse, that's not necessarily a good thing. And the degree of occupational segregation also means that these jobs that are associated mainly with women are low-paid jobs quite often because they're low-valued.
And the professionalism, as you mentioned, isn't mentioned. The word just tends to be in there a lot, doesn't it?
Exactly. I'm just a nurse, or I'm just a social worker. And nursing's actually quite an interesting parallel, because, you know, the old adage of the nurse being the handmaiden of the doctor, and that was really challenged through the professionalisation of nursing. And nurses became much more assertive, you know, much more involved in actually what was seen as the cure part of the job. And some nurses at the time were rather annoyed about that, because they felt that the care component would be valued. And I think that's what we want to hold on to in social work. You know, it's really important that these are seen as professional roles, professional jobs, but we need to value care for care's sake and acknowledge that this is a professionally skilled job.
Is it the same for social care and social work, or is there a difference in social work in that it doesn't have the care word in there?
It doesn't have the care word, and it's a professionally recognised qualification. So I think most people do perceive social workers as being trained, as having qualifications. And in your introduction, Wendy, you mentioned the pandemic, and I think the pandemic really alerted the public to what social care workers do. And there was quite an interesting debate going on during the pandemic, you know, about why did we not know this before? Look at what they're doing. It is really skilled. And I think we need to try and hold on to that, because if we don't, and we don't recognise the value of this work as a society, we won't be able to sustain it. And it's for the Northern Ireland economy, health and social care in particular is a growth area.
Paul, from a social care council perspective, talk about this a bit for us. Is this a really big challenge for the social care council?
Well, I think workforce generally within social work and social care is a huge agenda for us going into the future in terms of attracting the right people into both social care and social work. In the Social Care Council, we have a registration of total 44,418 people on the register. 6,540 of those individuals are qualified social workers. We have 774 students in there, and the remainder, which is 37,000 odd social care workers from Part 2 of the register. Now, that's a huge workforce. It's bigger than nursing in Northern Ireland. It's bigger than the finance and IT industry. And as Anne-Marie said, no one would think that. It's perceived as a small workforce. Certainly the differentials between social work and social care need to be explained. Social work is a statutory role. It's there to upstand and support legislation around equality, human rights, particularly when we're talking about inclusivity and diversity. And we have an increasing diversity in that workforce, not as many as we need, but we have people now coming to Northern Ireland that wouldn't have been here 10, 15, 20 years ago. And I suppose as a health and social care system, we have to be able to understand people from different cultures who come here and make certainly provision within our services to uphold the same level of support that we would support ordinary citizens in Northern Ireland. And that's a significant ask, particularly in the Northern Ireland context, when we've come in from, a legacy of troubles and where there was very little diversity and do you get into the whole issue around tolerance versus acceptance? There's a real issue in Northern Ireland around, do we just tolerate people who come to choose to live in Northern Ireland and work here, or do we really accept them and support them to integrate? So that's a huge issue for social work around different cultures and making sure that our social work of today and tomorrow are equipped in terms of the knowledge and skills to properly support those individuals. So from the council's perspective, we really want to see greater diversity within our communities, within social care and social work particularly. And we had pre-Brexit significant numbers of individuals from all around the world. And they've come and chose to come and work in Northern Ireland. Huge challenges for those workforces because, we have had big campaigns whereby we encourage people to come and work here. And indeed, at the minute, post-Brexit, that's a real issue. How do we develop new workforces outside the existing? Because we have huge vacancies. So it's just not about attracting people into Northern Ireland. It's what supports do they need when they're here? And how do we best do that?
Do you need to be ahead of the curve in some ways? You talk about the difference between tolerance and acceptance. And for an awful lot of people in Northern Ireland, they don't actually have to deal with the diverse element of society nowadays. They can stay in their own little bubble, if I can put it like that. Whereas, if you're trying to develop your social work and social care workforce, do you need to be ahead of the rest of us, really?
Well, I think you tend to be aware of the complexities and the difficulties with this workforce. And in my role in the past, I've been dealing with people coming from other countries and mapping qualifications across to make sure that they can work effectively within a Northern Ireland context. And the stories from individuals around the difficulties, just moving to another country is huge, and bringing families and housing and, welfare issues, doctors, all those things. It's just not about getting a job. It's about how you integrate within communities in a safe way, and being welcomed into that context is really, really important. So we've learned a lot, I think, from talking to social workers who've come to work here from Africa, from Eastern European countries, and we need to understand what are the gaps for those individuals in relation to housing and integration. And we have that as a real issue right across the healthcare system, because we have young GPs who won't go into rural areas because they're not there's no integration there. You have F1 doctors heading off to the west for, to do their qualifications, living in a hospital setting and then moving back to the city. So we have a real issue in Northern Ireland around how we attract the right people into the right roles across the region.
You're nodding furiously, Anne-Marie.
Yeah, I think we're in a process in Northern Ireland that we have been, for obvious reasons, so preoccupied with religion and with anti-discrimination in that respect that we are probably a little bit behind the curve in terms of a society and how we deal with all of the other inequalities, whether it's race, disability, even gender. Every year we chart attitudes to ethnic minorities and race through the Northern Ireland Life and Times survey, and that's been quite interesting just over the past 20 years, seeing how those attitudes have changed. And I think there is some scope for optimism. So when we look at the annual survey of 16-year-olds, we see that there's much less prejudice there than there would be in the adult Life and Times survey. But we do see worryingly still high levels of prejudice, I think. And we do see more contact, but still quite limited contact. So we ask people about their contact with ethnic minority groups. So I think it is something we need to be mindful of when we are trying to attract workers, that we're attracting them to a region which, where we are not yet as confident and as comfortable as we should be. Even in England, recent survey of social workers show. I think what the results showed was that a quarter of social work staff had experienced racism in their job from colleagues. So that wasn't even getting at what they experience, in their, in the wider setting. So I think we don't have very good data here in terms of what racism or discrimination professionals encounter. Anecdotally, we hear sometimes about prejudiced attitudes, whether it's in residential homes or in community settings, and it's probably not called out in the same way that it would be in hospitals, for example. So that's probably something we need to think about as well.
Do people's attitudes change, I wonder, when they're in a situation where a person that they would have not had a good attitude towards actually is the person who's looking after them? And do they realise then that this is a different, that this is actually where they are?
Absolutely. I mean, you just have to look at what's happening in the UK at the minute, where within the National Health Service around, people from ethnic minority groups talking about how they've been received and bullied and treated. And that's within our health service across the UK. So we can't be blinkered that won't happen or doesn't happen here. And I think there's, the real issue, I suppose, in the value of social work is that it has to stand up for those social justice issues right across the piece. So it needs to be advocating and supporting and calling out practices that impact negatively on communities. And, the role of social work in inclusivity and diversity is really, really important to be able to make those connections within the system. So I think it's really, really important. And we know from our experiences in, people from ethnic minority groups working in social care services, how the local citizens might respond and react. We've had that in nursing within hospitals. So there needs to be a zero tolerance to that sort of behaviour, because it is, there's hate crime in there. There's really significant impact on individuals who, after all, are there to care and support. So if we want a really inclusive society, we have to have those discussions and debates and call out practices that are really unacceptable. And social work is really to the forefront of that in terms of, really supporting individuals right across society.
Well, I suppose, unfortunately, there's not that much that we can do to educate right this minute the people who are the receivers of the care, but the sort of situations that Paul's talking about where there's racism or bad behaviour within organisations, that is something that can be dealt with. What can be done there, Anne-Marie, to ensure that at least in the workplace people are treated well?
Well, we actually have in Northern Ireland, as in the rest of the UK, a very strong body of legislation. I suppose there's two problems here. One is that legislation in itself is never enough, because we do need that attitudinal change as well. But we also need to be better at delivery of policy, implementation of legislation. And we see this in every area of our legislation, actually. So with regard to gender and race, the strategies which we have here are now really out of date. So the government had been in the process of developing a new gender equality strategy, for example, strategy and equality for disabled people, and working on a new race equality strategy. But of course, because we don't have a government now, we are really far behind with those. And the development of those new strategies did ascertain that implementation around former policy and former legislation had not been as effective as it could be, and the lessons were learnt from that. But we just urgently need these things to be signed off by government, and for that process of delivery to take place. So I think we could be optimistic in that government is developing a good body of strategic policy. I think the challenge for us in this place will be the politicians putting that into place.
I mean, there are some circumstances where, while it's bad news at the time, if you like, those delays can end up not being as much of a detractor as they might be, and that you can kind of leapfrog some of the problems and pick up on the good practice and then kind of move forward. Is there? I'm grasping at straws here. Is there a chance that we might be able to do that?
There may be some chance, but I think we also have to be really clear about admitting our mistakes as well. So just not to bog people down in legislation, but our statutory Section 75 legislation covers 9 categories. Now, there has been a disproportionate focus, I think, on religion in terms of the application of that legislation, but also a misinterpretation of the legislation. So what policymakers have tended to do, and statutory agents, is to feel that legislation means you have to treat everybody the same. And it doesn't, because if you treat everybody the same, you never get beyond the historical base. You're just embedding the inequality. And yet we know from our research that policy has continuously done that. So I think in some way you're right, that period of inactivity around policy has given us time really to drill down into some of those problems, and for some of the new strategies do acknowledge that is the case, and that we need to move away from a neutrality in policy making towards more positive action to make up for previous challenges. Paul?
Yeah, I think that's a very important point. If you're looking to develop a society that's inclusive and diverse, where many different cultures living within society, immigrants arriving, and we know the big debate at the minute in the UK around migrants and how we treat them. But I think there is a very positive story to be told around diversity, and we need to get better at talking about that. Rather than seeing anybody that's different from ourselves as a problem. So diversity promotes tolerance and understanding between different cultures. It enriches communities through shared experiences with different people, and it attracts more money to our economy, and that's particularly important in Northern Ireland at the minute, because we have a fixed number of economically active people in Northern Ireland. We have a huge number of roles and posts, that we can't attract people into, and that's the same right across the UK at the moment. So, we need to get better at supporting people with disability into employment. They're the significant numbers that don't have a job and want to work. We also have a significant percentage of our Northern Ireland population that are economically inactive. So we need to do a lot more around attracting those individuals. And we need to attract people from other countries into Northern Ireland. That's the reality, because we'll not have the services or provision needed for the population unless we do. So we need to move away from seeing people who are different we don't want people different in our society. We actually have a whole range of diversity already in our society, and we need to get better at that inclusivity piece.
And celebrate it, perhaps. Yeah. What about training? Now, I mean, that must enter into all of this, mustn't it? As far as the Social Care Council is concerned, what sort of training takes place? What kind of assistance is given to aid inclusivity and promote diversity?
Well, I think that's an important point. Right across the health and social care system, we have significant numbers of people coming in from Syria, different immigrants who have had come to Northern Ireland for safety. I mean, I've heard of one case recently where a qualified doctor is working as a care worker in a nursing home. So we need to get better at sort of processing and supporting people to connect in. We've just recently finished a project as part of our reform work with the Prince's Trust, and we had a number of young migrants who are now able to work in Northern Ireland and really want to work and will bring huge added value. In relation to social work, whenever someone comes from another country and chooses to come to work in Northern Ireland, there needs to be mapping in relation to qualifications. So we need to make sure that under the old EU directive, you were really supporting people living up, in a sense, if the relevant qualifications or the practice was fitting. There were opportunities to support people, so compensation measures, developing the expertise in relation to legislation, etc., within the Northern Ireland context. So as a council, we would have been very significantly involved in encouraging those applications and processing them, mapping them across and trying to integrate people into employment in Northern Ireland. And that has been a really, while it's not huge numbers, it's brought a lovely connection. For example, if you're a migrant worker and you have from Eastern European country and you have a social worker who has that background, it brings added value in terms of how we manage different cultures in our society and how we support them.
What about developing diverse teams and leaders? I mean, teams are big things now, aren't they? And no organisation works without people being involved in a team. But that can be difficult in itself if you have a real mix of people in there. Marie, I mean, have you been looking at that at all, or how does it work even in your own circumstances?
Well, I think just before moving on to that, I just wanted to pick up on something Paul had said about training, if that's okay, Wendy. And I think from a university perspective and from a training professionals perspective, I think the curriculum is really important. That in the curriculum, when we're training social workers or we're training social care people, we address those discrimination issues. We address those through anti-oppressive practice and such, because social workers have a really privileged role as promoters of social justice in the communities that they work in, but they need to be equipped to do that. And and again, I think historically we've focused on religious discrimination, but we've moved a long way away from that. So hopefully that will have a positive impact as well. In terms of leadership, I'm not a leadership expert, but from your experience of working in any team and knowing what you read about professional development and professional working, that message has to come from the top. That we appreciate diversity, that there is no tolerance for discrimination, and that there's open conversations as well, and that people, what the research in England has actually highlighted is that people don't always report their concerns around bullying and harassment because they feel they won't be listened to, or because the discrimination or the harassment is so subtle that they don't actually know what they ought to be reporting. And we're not great at talking about racial discrimination. And I think people are open to that conversation, but we don't always start it. It always strikes me whenever we ask questions in the Life and Time survey, we ask people directly about do they feel they're prejudiced and so on. People answer those questions quite honestly. And that creates a space to have these conversations and to have them in workplaces as well, and for leaders to instigate those.
That's very interesting, because I was going to ask you, do we just need to be more honest about all of this? As Paul's explaining, we don't have the workforce ourselves here unless miraculously, we do get the people who are economically inactive back to work. They're not all going to go to work. We're not going to get all people who have a disability to be working either. We need to have people coming from other places to support all of these services and other industries as well. Do we just need to be more honest about this and stop maybe dancing on the head of a pin?
I think we absolutely do. When it comes to any issue of discrimination, I think we have to be very clear that there is a problem. I don't think we should be subtle about these things. I think we need to call it as it is, that these services are not sustainable. Lots of our economy is not sustainable, and particularly in Britain, Brexit has had the most catastrophic consequences for the social care workforce. In particular, it has just decimated it. And the workforce in England in particular is at point of crisis. And, we are facing real substantial challenges here as well. So we won't have the people to look after us unless we address all of these issues, both grow our own workforce and make this seem like an attractive career option, but also understand that we are going to be dependent on people coming from other countries for some time.
Do we tell enough good stories about them? I wonder, Paul. Good stories and interesting stories. When I was speaking to someone the other day who was saying that he had a client who makes face masks and that they'd had to change their template for Filipino workforce because they have smaller heads. So that they have a different side. Now, that sounds like a kind of silly story, but it's stuck in my head. And it does make you smile, and it just makes you realise that different people are different. Do we do enough of that?
Well, I think we need to continue to develop good news stories, particularly around social work and social care. They're very challenging roles. Being a social worker in Northern Ireland is unique. Given the legacy, given the trauma of our society, and the role that they provide within that. We don't really, I suppose, talk enough about that. And we've been proactively, having those discussions in the last number of years, just in terms of the voices of social work. The impact in terms of working in communities, community development work that social work undertakes. And that is about upholding the social justice issues and calling out those people who are affected and impacted by race or by, poor circumstances in relation to their own situation. So social work has a huge part to play in articulating what type of society we should be working within in terms of upholding the legislation, the policies, the equality, human rights. And that's really, really important that we don't lose that. Sometimes you can get caught down the gatekeeping resources and the focus is on that. But social work has to stay to its roots in relation to those pieces, and they are very aware of the complexities and the challenges. Indeed, I think the barriers for people living in our society, in terms of particularly coming to work here, lower paid, living in areas that are, not as well off, having barriers to training and engaging in training and development is a big issue if you're coming and you don't know here. I remember a year ago during COVID meeting this homeless man one evening in the city centre, and he was begging for food, and he was a fisherman from Lithuania, and he arrived into Ardglass just as COVID went into lockdown, and he was left with no money, nothing. He found his way to Belfast and sitting on the curb, not wanting to go home because people would see him as a failure. So, that's the real impact of not supporting people properly. People who, this man worked all over the world, so he was more than willing. Circumstances changed that for him. And that's what happens with people coming into our society. They're coming here with all sorts of complexities and challenges. And as a society, we have to look at how we best support those individuals and engage them into our society in an inclusive way, because they have a lot to provide.
So where do we go from here? Anne-Marie's talking about the enormous impact of Brexit on this whole workforce, both in GB and here in Northern Ireland. I mentioned at the start we're 25 years on from the Good Friday Agreement, and there are aspects of that we haven't even sorted out, never mind the bigger picture of what we're talking about at the moment. How do we move forward from here, Anne-Marie?
Well, it's a really good time to be reflecting on this, Wendy. Equality was at the heart of the Good Friday Agreement, and we have come some long way in terms of addressing the violence, but we've come much less of a way in terms of the everyday piece, if you like, addressing these equality and justice issues. And I do think we're finding ourselves in a place now that there's increasing recognition that we need to be moving on a bit more rapidly to give people confidence that peace is working for them. And some of the users of social work and social care are some of the most vulnerable people in our society. And they're the people who've maybe in some ways benefited at least from the peace dividend, if they're living in really difficult socioeconomic circumstances. So I think in order for those people to be supported, we need to support the workforce that can do that. There's challenges in recruiting for the workforce and retention. But Paul has talked about the rewards that come with this work and the really positive outcomes that can come from it. But we do, as a society and as a government, need to invest in it. And we actually need to professionalise social care. And I think there's increasing recognition of that we need to. Half of our social care workers have no qualifications at all. They're doing really skilled work. It's just not recognised. But we need to make sure that they are actually properly equipped to do that they have access to learning about the values that will help them, to stay as good care workers. And we have to pay for that. And we have to pay their wages.
And therein lies a very large part of the problem, Paul.
Absolutely, and we're making progress there. I think you can. In Northern Ireland is a complex region. We're still struggling with ourselves. Never mind other groupings or individuals who want to come into our society. We know that professionalisation of social work certainly increased the number of males coming and wanting to work in it, and that's the same for nursing as well. So I think good training and development around. I think it's also being part of the wider debate in Northern Ireland. Really is. I mean, the protocol is a good example of how do we ensure a better, prosperous society for all. And I think moving our society to thinking in the collective as opposed to groupings is a journey in itself. And we have a lot of work to do, I think, going forward. But there is something about this levelling up is a big agenda in the UK. But we need to level up in a connected way in our society and embrace diversity and change and celebrate it. And that will pay huge dividends in terms of the richness in our society in the years to come. Young people won't tolerate. I've just read yesterday, I think, there's something like 1 million young people have left Russia. That's a huge issue. So when societies get things wrong, people leave.
Well, that's happened here for years, hasn't it?
Absolutely.
Hopefully that's not going to be the case in future because we're running out. Well, look, thanks both of you very much indeed for talking about this enormous topic. We could actually do a whole series, I think, on fostering equality, diversity and inclusion. But that was really interesting to hear from both of you. So my thanks to Anne-Marie Gray, Professor of Social Policy in the School of Criminology, Politics and Social Policy at Ulster University, and to Paul Rooney, Professional Advisor at the Social Care Council. This has been Care to Chat, a podcast from the Northern Ireland Social Care Council. Thank you so much for listening. And if you'd like to learn more about careers in social care and social work, visit niscc.info, where you can find inspirational stories, great learning resources, podcasts, and much more.